Welcome. My name is Benita Katz. Thanks for listening today. This talk about hormones of childbearing is based primarily on the publication The Hormonal Physiology of Childbearing by Australian physician Sarah Buckley. That publication is available online and is referenced on the last slide of this presentation. These are the 4 hormones that have the greatest effect on childbearing. Each of them plays a distinct part, and at the same time they interact with one another. I've heard it referred to as a hormonal dance. As we discuss these 4 hormones, oxytocin, endorphins, catecholamines, and prolactin, you may come to understand why that is an appropriate analogy. One note before we dive in. This short presentation is a very brief overview. For more details, please see the references listed on the last slide. Oxytocin is often referred to as the love hormone. This hormone is released during any skin-to-skin affectionate interaction lasting 20 seconds or longer. For example, a mother hugging her child or the embrace of a husband and wife. Oxytocin is the bonding hormone, the biochemical reason that we feel love for one another. It also plays a part in the process of childbearing. The release of oxytocin causes contractions of the uterus, resulting in dilation and effacement of the cervix, as well as the movement of the baby down through the pelvis. Continued release of oxytocin after the baby is born results in the birth of the placenta. Even after the birth of the placenta, contractions caused by oxytocin help protect against postpartum hemorrhage. Oxytocin has similar effects in the breast tissue, causing the myoepithelial cells to contract, releasing mother's milk into the milk ducts. Oxytocin and pitocin, or syntocin as it is also called, are chemically identical. The difference in the body's reaction to them is based on the way they enter the body. Oxytocin is released in a pulsatile manner from the posterior pituitary gland into the brain. It then filters into the bloodstream. Pulsatile is a word, think about your heartbeat, your pulse. It pumps and rests, pumps and rests. This is how oxytocin is released into the brain in a rhythmic sequence. Pitocin, on the other hand, is released continuously into the bloodstream through an IV, or an intravenous catheter. Because pitocin does not cross the blood-brain barrier, the calming effects of oxytocin do not occur. The result is that pitocin may increase stress levels, not only because the pain of contractions is more intense, but because the calming effects are not reaching the brain. Oxytocin also acts as a neuromodulator, affecting the release of other hormones. That is the hormonal dance that I mentioned. When one hormone is interrupted, it has the potential to affect the entire sequence of hormonal interactions. Due to oxytocin's influence on social behavior, especially mothering behaviors, some believe that it could be helpful in alleviating postpartum depression and anxiety. In a 2017 study of almost 10,000 women, Danish researchers hypothesized that those who received pitocin during or immediately after labor would be less likely to develop postpartum depression or anxiety. They were surprised to learn that this was not the case. This is attributed to the reasons just mentioned. Pitocin administered through an IV does not cross the blood-brain barrier and therefore lacks the calming, stress-reducing effect of oxytocin that is released in the brain. Oxytocin promotes labor progress. So, what can we do to support and encourage the release of that hormone? Helping a woman maintain her privacy, helping her feel safe and secure will promote the release of oxytocin. Being cared for by people she knows and trusts will also contribute to that sense of security. We are all more hesitant with strangers. When a woman feels frightened or exposed, stress hormones like catecholamines are released. Catecholamines and oxytocin are often released in inversely proportional amounts. That is, when oxytocin levels are high, catecholamine levels tend to be low. The opposite is also true. Most of the time, when catecholamine levels are high, oxytocin levels are low. This is why stress and discomfort early in labor tend to slow labor down. Dim lighting also encourages oxytocin release and labor progress. Interestingly, oxytocin and melatonin are synergistic hormones. Melatonin is the hormone that our brain releases, usually at night, to allow us to relax and sleep. It's one of the hormones that establishes our sleep cycles. Together, oxytocin and melatonin work to support mental relaxation and therefore labor progress. Some suggest that this is why so many labors begin at night. Affectionate or supportive touch can promote relaxation. It is calming for women to know that someone is nearby and caring for her. But if someone is asking her questions, making her think, it is more difficult to relax, and this can slow labor progress. All of us are more relaxed in comfortable environments. It's no different for laboring women. And comfort may look different for different women. Some women may be comforted by the presence of technology. Others may want their favorite pillow or music or even a picture of a peaceful scene. Whatever comforts them. Comfort may be something as basic as room temperature or lighting. But helping a woman be comfortable helps her relax, and that promotes oxytocin release. Endorphins are opiate-like hormones that activate the pleasure centers of the brain. Distance runners tell of an experience referred to as hitting the wall, a point in time when they feel so exhausted that they don't want to go on. But they know if they push through this point, endorphins are released and they experience a runner's high, a feeling of immense joy and satisfaction. It is the same type of exertion that causes the release of endorphins in laboring women. Endorphins have some analgesic effect, making the pain of labor more tolerable. When levels of endorphins peak after the baby is born, mothers may experience feelings of euphoria. During breastfeeding, endorphins trigger reward centers in the brain of both mother and baby, which reinforces this positive behavior. Catecholamines are a category of hormones that include adrenaline, noradrenaline, and cortisol. These hormones are released when one is stressed. They give a surge of energy, which is a good thing if you are in a dangerous situation and need to run away. When this fight or flight response is triggered, blood flow to the uterus, placenta, and baby are reduced. The body prioritizes blood flow to the lungs and skeletal muscles so that a person can quickly flee. High levels of catecholamines are associated with longer labors. As I mentioned before, levels of catecholamines and oxytocin tend to occur in inversely proportional amounts. If a woman is stressed early in labor, it usually slows labor down. Because there are higher amounts of catecholamines, oxytocin levels will drop. Adverse fetal heart rate patterns are often noted when catecholamine levels are high. As stated previously, the body directs blood flow away from the uterus and baby in order to prepare to flee. However, in the second stage of labor, the birthing stage, when the cervix is fully dilated and the woman is ready to push, catecholamines play a helpful role. They give the woman an extra surge of strength so that she can birth her baby. It's hypothesized that during this time, increased levels of cortisol actually increase the effects of oxytocin, which enhance contractions as well as the emotional bonding that oxytocin is known for. This may also enhance a woman's mood in the postpartum period. Prolactin is a hormone released throughout pregnancy, birth, and the postpartum period. During pregnancy, prolactin promotes the development of breast tissue. Prolactin is also known as a mothering hormone because it causes nesting behaviors, those things that mothers do to prepare for baby's arrival, and as well, mothering behaviors, actions that demonstrate a connection to the baby, such as holding and looking at the baby. Prolactin is also responsible for milk synthesis. It is prolactin that stimulates the breast to make milk. Oxytocin is the hormone that contracts the myoepithelial cells to release the milk. Prolactin has a calming effect on the mother, which is associated with reduced anxiety and tension. Men do not produce prolactin at the same levels as women, but it is present in their systems and promotes similar nurturing behaviors in fathers. Forgive my feeble attempts at drawing, but I think this is clear enough to help you understand. Each of these hormones has an effect on the mental and emotional state of women as they labor. When you are with a woman in labor, note the emotional milestones. Early in labor, she converses pleasantly and is easily distracted. But as labor becomes more intense, she shifts to a more inward focus. She does not want to be distracted. Largely due to this hormonal dance that we have just discussed, she moves from using the more intellectual part of her brain, the neocortex, to using the more instinctual part of her brain, the brainstem and cerebellum. The type of brain function, intellectual or instinctual, affects our ability to process what is happening. Women are emotionally vulnerable at any time during labor, but that vulnerability increases significantly as she uses more of her instinctual brain function. At times in late labor, comfort is more effectively communicated using touch or brief phrases. Women can be severely traumatized when this process is disturbed. This kind of trauma can have lasting effects for the woman herself and for her family. Does interruption of the sensations of labor change the hormonal processes of birth? Yes, it does. That interruption could be many things. The woman experiencing fear, or a medical procedure, or some type of medication. Most interventions have an appropriate use, but we must balance risks and benefits. Is the benefit of the procedure or medication worth the risk of interrupting the hormonal process of birth? Are there long-term consequences? There certainly can be. Teaching women about this hormonal dance can help them understand the importance of physiologic birth. The Lancet, a British medical journal, has described the shortcomings of maternity care as falling into two categories: too much too soon, or too little too late. Too often in Western medicine, we interfere too much too quickly. Helping a woman to follow her body's signals in physiologic birth is the healthiest way. Knowing when it is appropriate to offer medical aid is a skill that we can spend a lifetime learning. Thank you for listening to this presentation. For further study, please note the resources listed here. I've given just a brief overview of the hormonal physiology of childbearing. I hope it has piqued your curiosity and that you go on to learn even more. If I can answer any questions, please contact me through my Facebook page that you see here, www.facebook.com/Hearthstone, Wyoming. This is Benita Katz, sending you warm wishes with hope for a healthier tomorrow.